How does obesity increase atrial fibrillation, AFib, risk? Obesity is a major factor that can raise the risk of developing atrial fibrillation, which is an irregular and often rapid heart rhythm. This happens through several interconnected ways that affect the heart structure, electrical system, and overall function. When someone is obese, their heart has to work harder because of increased blood volume and cardiac output. This extra workload causes the left atrium, one of the heart's upper chambers, to enlarge or stretch out. Over time, this stretching creates a perfect environment for abnormal electrical signals that can trigger AFib. In addition to the atrium enlarging, the walls of the heart's left ventricle can thicken, a condition known as hypertrophy. This thickening makes it harder for the heart to relax properly between beats, leading to increased pressure in the left atrium. The increased pressure and volume cause further remodeling of the atrial tissue, making it more susceptible to irregular rhythms. Fat around the heart, called epicardial adipose tissue, can also infiltrate the heart muscle, causing local inflammation and scarring. These changes disrupt normal electrical conduction pathways, increasing the chance of AFib. Obesity also causes electrical disturbances in the heart. It slows down electrical signals and makes their pathways more irregular, especially around the pulmonary veins, which are common sites where AFib triggers start. The presence of fibrosis or scarring in the atrial tissue from inflammation further distorts electrical signals and creates reentry circuits that sustain AFib. Obesity-related conditions like sleep apnea can worsen this effect by causing intermittent drops in oxygen levels and increased sympathetic nervous system activity, which can trigger abnormal impulses and make the heart more prone to arrhythmias. The systemic inflammation caused by excess fat tissue plays a significant role as well. Adipose tissue releases pro-inflammatory substances that promote inflammation both throughout the body and within the heart muscle itself. This inflammation encourages fibrosis and electrical remodeling, making the atria more vulnerable to irregular rhythms. Obesity often comes with other health issues such as high blood pressure, diabetes, and sleep apnea, all of which add stress to the heart and increase AFib risk further. Sleep apnea, in particular, causes repeated episodes of low oxygen and arousals from sleep, which raise sympathetic activity and pulmonary pressures, leading to changes in the right side of the heart and more atrial remodeling. Research shows that obesity not only increases the chance of developing AFib but also makes it more likely to progress from occasional episodes to persistent or chronic forms. People with obesity and AFib often respond less well to treatments aimed at restoring normal rhythm and tend to experience more recurrences. The good news is that weight loss and improving overall fitness can significantly reduce the burden of AFib and improve health outcomes. This highlights how managing obesity is a key part of reducing stroke risk and controlling AFib. In summary, obesity influences AFib risk through changes in heart structure, electrical activity, and systemic inflammation. These factors combine to create an environment that favors the development and persistence of abnormal heart rhythms. Because AFib is a major risk factor for stroke, addressing obesity through lifestyle changes and medical management is essential for better stroke prevention and overall heart health. Always consult with healthcare professionals for personalized advice and treatment options tailored to individual needs.